The early months after the law went into effect, did we see any changes in terms of fear, discrimination? And in fact, what we did see in the data is that there was a significant increase in MSM reporting that they were afraid of accessing healthcare services. It increased about 15%, 10 to 15% across a variety of variables around stigma and discrimination, fear of accessing healthcare services, avoidance of healthcare services, blackmail, harassment, and really a lot of indication that at least in the early months after the law has gone into effect, that MSM were more afraid to access healthcare. And obviously, that's a huge concern because access to healthcare is what is critical to help achieve HIV prevention and treatment outcomes. Separately, we also saw that amongst MSM that were afraid to talk to a healthcare provider about their same-sex behavior were less likely to be virally suppressed at baseline, and throughout the longitudinal follow-up, less likely to initiate ARVs. So, we can see both that the law has had seemingly an impact in terms of fear of accessing services, but also an environment in which people are not comfortable talking to their providers results in poor health outcomes.
And post the law, we also conducted a survey in terms of looking at why men who have sex with men weren't showing up at the clinic, as against having around 60 people every month down to around 10 to 15 people a month. We rolled out a survey surveying 115 men who have sex with men, and the fear of dying in prison or going to prison, people preferred to stay at home and rather die on their sick bed. So that became an issue for us, and we looked at that deeply, and then it shows that around 73% of them had stopped accessing healthcare service for the fear of being discriminated or the fear of being arrested for who they are, based on the law that has been passed. And what we have heard also come out from the Nigerian government is keep saying to us that the law does not affect service provision. And we keep asking, when you tell people that they are going to go to jail for 14 years for being who they are, or go to jail for 10 years for aiding and abetting in terms of service provision, where do you want them to be? How do you reconcile the both things? Do you want to eat your cake and have it back? Probably because you're trying to talk to donors to get donor funding back into your country. So we need to get things straight. And what we're trying to do is to collect all the information that is available out there to show clearly what the impact of the law has been pre and post the law. Thank you.